Bula vinaka, talofa lava, maloi lele, tēnā koutou katoa, and warm Pacific greetings. Welcome to our first Moana Research webinar titled Pacific Maternal Mental Health. My name is Dr. Sain Taufa. I am the research lead at Moana Research, and I'll be facilitating our talanoa this evening. There are two main objectives to this webinar. Firstly, to understand the risk factors for Pacific mothers and fathers when it comes to mental health issues. And secondly, to understand the role that culture plays in delivering care to our Pacific mothers and fathers, specifically on mental health issues. For those of you who are tuning in, an overview on how we're going to run things this evening. We have an hour together. I will introduce each of our amazing panelists. And we've prepared some questions which I'll ask post introduction. We also have we also will be taking questions from our viewers. So while the talanoa commences, please feel free to send through your questions or your comments as we go. Part of my role is to make sure that we stick to time. So if we don't get to your questions, don't worry, we'll post your questions on our websites, www.moanaresearch.co.nz. We will also plug our recordings on our social media platforms. But now, in true Pasifika form, we would like to begin our talanoa with a prayer over this webinar, and we are fortunate to be joined by our Pasifika Matua for Counties Manukau Mental Health and Addiction Services, Alfata, who I will now invite to start off this webinar with a lotu. Malo. I'll hand it over to you, Alfata.
O matu o mai o lumba le nei tu la fiafia watu viinga malwhaktai o na lau tau singa whai pēa mo i mātou lau whanau o mwhai ai o na mātou poto mai le nei a fiafi. Ai mai se ai fo inisi o mawhai o na maua mai le nei whasalaunga o mātou talo le ia fio mai alo wanganga pa ia tai tolu ina i mātou umalaba o le a whati noina le nei wha moe ina ia mawhai o na mātou whaia ma le anganga wha maoni a wā se manuia o mātou tangata ni mea le lei ni mea fou a wā le wha le leia o a wala o au nanga i tu tonu lava o le leia tunu o mātou talo le ia au noa malau o fio e le mawhai o na mātou whaia le lei sauninga ai o mātou talo atu i a mata le nei wha moe lau o fio wha i wina i lau o fio. Ona i siukeleso o mātou wole mbala au atu ai. Amen.
Amen. Thank you so much, Alfata, for that beautiful prayer. I'm privileged to introduce four absolute stars, each wearing various hats and who continue to contribute to our Pasifika people in the mental health space. Our first panelist is Dr. Siale Foleyaki. And this is when I put on my mate maadonga cape. Dr. Foleyaki is a Tongan psychiatrist with over 20 years of experience working on the front line of mental health services in South Auckland. He was the lead researcher for the Te Rao Hinangaro New Zealand Mental Health Service and has helped establish multiple Pacific health organisations such as the Tongan Health Society, the Whaleola Services, and Wakatoa. And I had to add this for my dad. Like many great Tongans, he came through the School of East Pantry. Sorry, Siale, I had to plug that in. Maloi lele, Siale, and welcome to this webinar. Can you tell us a little bit about yourself and why you chose to enter a career in mental health?
I'll make it short, Saini, because you know, my journey into becoming a doctor was there's a cultural / spiritual element to my journey. It starts off as a small child. I heard a story about how my parents named me after one of Tonga's very first medical doctors, and it was kind of like how do we put this, a combination of destiny and family pushing you along to, you know, a role that they wanted, you know, a young person to perform on behalf of the community. And then when I did medicine, you know, I'm deeply interested in, you know, what it is that we do as human beings that enable us to have good and rewarding, fruitful lives. So I was much more interested in mental well-being than I was in mental illness, to be honest. But mental illness, if we experience mental illness, it really does stop us from, living that life that I think we're all capable of living. And I think that, my natural inclinations as a person align with psychiatry. So it was a combination of family things, my own personal characteristics and attributes, and my curiosity around, living a life well and helping others to live a life equally well. So that was kind of the reasons that pushed me into psychiatry.
Thank you, Siale. With your extensive experience over the past 2 decades as a Pacific clinical psychiatrist, what are some of the changes that you've seen in relation to Pacific maternal and paternal mental health?
Yeah, look, if you think about the Pacific community, the Niue and the Cook Island communities, they probably were the first arrivals here in New Zealand, and so they've had the longest history of integration with New Zealand society. Then there was a large Samoan wave, and then I think the Tongans, we were out of the major Pacific populations in New Zealand, we were kind of the last wave. And when I arrived in New Zealand, there weren't a lot of Tongans when I arrived here as a small child. And I've watched as we've become more integrated into New Zealand life. I found one of the major hurdles that we had to overcome was some cultural differences and some intergenerational differences that put young Pacific people on a trajectory where we were significantly different to our parents and grandparents. And that journey requires of us to find a new sense of self, a new identity. And you'll find that in this conversation over the next hour, I'm sure our other speakers will talk to the fact that intergenerational change between us has occurred. We're much more culturalized as a group than we were in the past, and that is has its advantages, but it also has its disadvantages. And one of the major findings we found in Te Reo Hinangaro was that there was a large percentage that the mental disorders in our community, there was a significant difference between rates of mental disorders between New Zealand-born Pacific people and the Pacific people born in their native islands, and the age of migration was really important. So if you migrated New Zealand before the age of 12, your rates of mental disorder was significantly higher. If you migrated after the age of 18, or essentially when you had become an adult, your rates of mental disorder were lower. And that translates when a young person with a history of mental health issues becomes pregnant, both male and female, if they bring a child into the world, your mental status as a result of your exposure and experiences of New Zealand society have a big bearing on just how well that pregnancy goes and just how well you are mentally when that new child arrives.
Thank you, Siale. I guess the follow-up question to that is, you continue to work on the front line with our Pasifika peoples. What are some of the risk factors that you see becoming more prominent? And what are some of the treatment options that are made available?
Yeah, that's a really big question, Sam. And if you would list the top 10 risk factors for mental health issue ones, and so if you think about major risk factor for postnatal depression, for example, in a woman that has just given birth, the major risk factor is a previous history of a mental health problem. That's a significant one. The second one is there's a whole lot of obstetric reasons why a woman might get postnatal depression, but the main reason is intimate partner challenges. The third most critical issue is drug and alcohol related issues before the pregnancy. If they were there, then that's going to be a significant contribution. A lack of supports from the maternal side, so a mum, a sisters, aunts, and that fragmentation of supports is probably the other major risk factor. Some demographic things: the younger you have your child, that's a significant risk factor. There's social and economic things also play a part. So there are significant factors that we can understand and you can identify in a young person or in a mother that's giving birth to a child that gives you a sense of how at risk that pregnancy is.
Awesome. So you've highlighted the importance of relationships and also another element of toxic stress, when some of the triggers or the risk factors begin to build on top of each other, then you'll have that toxic stress can then lead to, issues around the sense of mental well-being.
Sure.
Thank you so much, Siale. I'm now going to move on to our second panelist, Dr. Jamai Matia Tiazi. As an alumni at the University of Auckland and having worked with Jemima, she is a true inspiration. She's always advocating for our Pasifika students, and she has a real heart for community. Jemima is the co-head of school for Te Wananga o Waipapa School of Māori and Pacific Studies at the University of Auckland, and her special interests includes Pacific studies, mental health well-being, suicide prevention, intervention and postvention, youth development and Pacific health inequities. Talofa, Jemima.
Talofa lava, Sani.
Thank you so much for being here. Now, I've provided a brief snippet of who you are, but can you tell us a little bit more about yourself and what shaped your special interest in mental well-being?
Like Siale, I think it's been something that has been inherent for most Pacific peoples. You know, it is holistic in the way that we breathe, sleep, and function on the daily. And so it's something that you can't quite escape. It's when it becomes negative and the impacts of all those external factors that come and disrupt all of that it becomes an issue. And it was because of that I became really quite intrigued by the sector, mainly focusing around suicide and suicide prevention and suicide postvention initially, and of course now just branching into lots of other areas.
Thank you, Maima. You were one of 6 panelists on the New Zealand Mental Health and Addictions Inquiry. What were some of the findings from that inquiry in relation to mothers and in particular Pasifika people?
There were 3 that really stuck out in my mind, and probably 3 that weren't spoken about nearly enough for all populations, but especially for Pacific. And of course, it's around postnatal depression, and that has been completely invisible. And it's something that Siale has been advocating for years and years, but still we haven't been able to, I guess, turn what's anecdotal into something that's more digestible and practical. And by this, it is increasing the lack of awareness around the mental health literacy for families, supporting women who are experiencing postnatal depression. We forget about the families around them, and being able to identify what type of help these mothers would need when they're suffering this. Also, for the people that support the mothers who are experiencing postnatal depression, usually they're not being paid to take care of the other children. So they're not supported fiscally or in any other type of way. And it's their well-being as well, those of the caregivers and of other, which is normally a family member, right? And of course, there's little research in this space. So for anyone in the mental health, Pacific mental health research space, you're on the right track, and I want to congratulate you, Sani, for being awarded that Health Research Council grant. Around that midwifery, it's usually a vocation that needs a lot more prioritization as well as nursing, but in terms of workforce development, and normally we have very low rates of our Pacific mothers engaging with, as you are probably well aware, with midwives. So how do we support those Pacific mothers who are presenting late and for pregnancy, for things that are completely, unavoidable? The point is, how do we support their mental health and well-being around that when those effects aren't as positive as we would hope them to be? And thirdly, around abortion, miscarriages and stillbirths. In relation to mental health and well-being, I think it's hugely important. This is probably not just the inquiry, but also a personal kind of interest of mine, is how do we support these mothers who have gone through an abortion, a miscarriage, or experienced a stillbirth? How do we frame that in a Pacific way? But for some, framing it in a way that is non-judgmental. We can't assume that all Pacific mothers are need faith-based support. I know this will open it up to so many debates, and I'm not here to open up that debate, but just to think around how we can possibly support those mothers. So it's hugely important that, especially with some of the policy changes that we're going to be seeing around abortion, that we are well aware of the mothers that have had an abortion or miscarriage or stillbirth that will be impacted by the discourse that is going to completely open publicly. And how do we safely look after our Pacific mothers in that space, and fathers and families in that space?
Thank you, Maima. And I think, going into HRC, that was one of the issues that we saw in some of the stories that we heard anecdotally was, especially when it came to screening, asking questions about how mothers are feeling. That's not as consistent as asking other questions like, finding out about mothers' diabetes and so forth. So you've raised some important points, and also drawing on the importance of the family as well, because we know that the way one individual feels will have an impact on the way those around them feel as well. Also wanted to ask you, Jemima, so according to the Growing Up in New Zealand study, there is a correlation between experiencing unfair treatment by a health professional and postnatal depression. You've taught papers on social theories such as unconscious bias, racism, and privilege. What role do you think racism and unconscious bias plays when it comes to the utilization of mental health services by our Pasifika peoples?
Good question, Sani. I think unconscious bias is prevalent in so many ways, and we experience it in its many forms, particularly as Pacific in the way we engage with services. And I think as a country, and we're seeing a lot more of it, racism has always been there. It's always been there. It's just, someone had said, it's just we never had social media for that whole time. So now, of course, it's going to be exposed. Excuse me. And I think as a country, we're kind of moving more towards what it really is, and it is racism. And so with racism, I think it can be really detrimental to our Pacific communities, because it not only widens the disparities, but it also just heightens the levels of inequity. So you can imagine that, issues around access, affordability, the workforce development, safety, cultural incompetence, all those things, the underpinnings of all those things are really racially biasly based. It's not even a word, but you know what I'm trying to say. And because of these unsafe practices, what they are actually doing is, well, here's an example. When a non-Pacific person asks you, tell me about your experiences, what that really is asking someone to do is walk me through your trauma. And I think that's a really unsafe practice to ask Pasifika people. And so I see that as a form of racism as well. The fact that we are omitted from certain conversations or not sitting around certain tables, particularly in the maternal health space, is a form of racism. So in terms of making decisions, in terms of transforming what it could look like, in terms of serving our communities, to the best way that we know how, racism, I think, is something that completely needs to be highlighted.
I totally agree. And we know that it's generational as well. So it's I've heard people say it's almost like a rite of passage for us Pasifika to go through different forms of racism, whether it be subtle or blunt in your face. And we know that racism happens at every level. The type that really gets me is when it becomes personally mediated, when it starts affecting the way our young Pasifika people and our elders start to view themselves.
If I could just add one small thing, sorry to butt in, I just think this is such an opportune time. And the point is, because my niece, a 12-year-old, I put on social media, she had experienced some form of racism by omission, so the coaches were completely ignoring her. The point is she identified that for herself. Now, if our young females are going to experience that type of thing in something like gymnastics, can you imagine what they're going to experience in terms of accessing the best type of maternal health? So I think we just completely need to be aware of that. So a lot more cultural competency training and a lot more, I guess, being confrontational about racism and how we can weave that into our practice.
Thank you, Maima. And I often say, this is a personal perspective, I think it's not enough to be culturally aware and competent. There has to be empathy that follows. And usually that comes from understanding the context in which our Pasifika people have come through. And I know that especially the way it's portrayed in the media, a lot of it is based on personal choices. No one chooses to, poverty is not a choice. And so some of the risk factors or the hurdles that we face are actually as a result of policy implications that are totally out of our control. But that's another webinar series. But thank you so much for bringing up those key points. We'll move on to our third panelist. Our third panelist is the beautiful Iris Foleyaki, a proud New Zealand-born Niuean who hails from the villages of Tamakautonga, Avaseli, and Alofi. She is the team manager for both Taunaki, a child and adolescent mental health service, and Whaletoa, which is a Pacific Cultural Clinical Consult Liaison team. I hope I said it correctly. She has a professional background in occupational therapy, and you will see throughout Talanoa has a real heart for serving our Pasifika people. So whaalofa atu, Iris. Najiki to take it off mute. So I've touched on Iris, I've only touched the surface when it comes to the multiple hats that you wear. Can you tell us a little bit more about yourself and your role as with an occupational therapy background in the mental health sector?
Lovely to everyone. I decided to become an occupational therapist because I wasn't quite sure what the profession was all about. I thought it was quite an interesting profession, and I saw that there wasn't very many Pacific in the role. So what really interested me was that the fact that it was a health sector role, and I wanted to get into health sector of some kind. So yeah, occupational therapy drew me, and I started the training over at AUT. One of the things that I guess in terms of occupational therapy for me and as a Pacific person is that I found that it was quite individualistic in the models that I had to work with. And so that was a challenge in itself, trying to look at the frameworks that I learned through the Western lens, but also try and accommodate some of those ideas and link that into my own upbringing as a Pacific person. So I thought, yeah, occupational therapy was quite an interesting profession. So I moved into that sector, and I first started my role as a Pacific health professional in mental health services for older people over at Auckland District Health Board. And from there, I moved on to the CAM sector. And I've gone through various services. So you could say, yeah, I've learnt quite a lot of different skills along the way. But now I've come into this role as a team manager in Taunaki, out in Counties Manukau, and the team manager for Whaletoa.
Hello, Iris. COVID-19 changed a lot of things, including the way we work. What were some of the things that have come to light because of COVID-19 that you believe affected the mental well-being of our Pacific mothers and fathers?
I think, first of all, the lockdown itself, like the idea of being locked down. So what does that mean for our Pacific people? What does that mean for our Pacific mothers and fathers? I think that's quite anxiety provoking for, you know, some of our mothers or fathers who are kind of thinking, you know, I may not have a job, you know, do I stay home kind of thing, and then, you know, staying home with the kids. I think that's a positive thing, staying home with the kids, but it also brings up some issues like financial stresses that, you know, the length of the COVID-19 lockdown, families might be wondering, you know, how do I provide for my family? How do I pay the rent kind of thing? And all those financial stresses that all come into play, and just being able to cater for the family. Because as Pacific, we all think as a collective, and it's like, so how am I going to put things on the table for my children? And, you know, just those sorts of things are really important for our families. And yeah, when it comes to education as well, like some parents would be essential workers, so their kids would be staying home. So who would look after my children while I'm at work? So then that would bring in maybe possibly the grandparents to look after some of the young kids. And, you know, COVID-19 also presented like the stress of, I guess, the infection between people. So we know that the older generation would be more susceptible to infection. So the younger generation weren't as, I guess, susceptible to the COVID. So it was kind of like, I think those sorts of things come into play when COVID-19 came on board. And I think it also, yeah, the anxiety provoking kind of ideas that come through, and, you know, as time goes on, even adding depression to some of those thoughts because of the isolation. We're not an isolated kind of community as Pacific. We socialize. When we see each other, we greet each other with a kiss or, you know, like a handshake. So it was really, really unusual not to be able to do that with each other. So I think, yeah, those things will come into play as well.
Yeah, and I think, you know, that also highlights the importance of messaging as well, because, you know, we use the word physical distancing quite a bit social distancing quite a bit during that time, when in reality it was more around physical distancing. The social element that's so important for us as Pasifika was, you know, still there and could still be done via different means like FaceTime or Zoom and so forth. As a manager, Iris, how important do you think it is to build our Pasifika workforce?
I think it's really important to build up our Pasifika workforce because, you know, we can't all be in each of the health sector all at once, but I also acknowledge that, you know, there is a limited amount of us in the Pacific as Pacific health professionals. So I also acknowledge that we also need to teach our non-Pacific clinicians how to work with our Pacific people in the best way possible. And it comes back to what Jamai said, is that cultural competency, and how do we engage and upskill some of our non-Pacific health clinicians in that area. Although, yeah, I think we can't always be in one place at one time, but I really encourage all Pacific people to look at the health sector. And it's quite a wide variety in the health sector as well. You don't necessarily have to come into mental health. There's like medical services as well. There's the hospital sector, there's the community sector. There's a whole variety, and I think we all need to be involved in whatever way. I think passion comes as a real factor that comes into play as well. I'm quite passionate about working with our Pacific people, and that's something that's, yeah, that drives me as well.
Thank you, Iris. You've raised a lot of great points, you know, about the need for representation across sector and across different health professions. I think also raising the importance of not just recruitment, but also advancement, making sure that we have, that people advance, you know, into different roles, so that we are sitting around the table and actually partaking in conversations where we influence the decisions that are made. Our final panelist is my Tongan sister, Makoni Havea. Born and raised in the beautiful kingdom of Tonga, Makoni migrated to New Zealand, where she graduated from the University of Auckland with a Master's of Nursing and was awarded with her nurse practitioner registration in 2019. Makoni is the first Pasifika mental health nurse practitioner in New Zealand. She works at Counties Manukau and is passionate about improving access for Pasifika families to health services and improving overall well-being. So Makoni, I've briefly touched on, the importance of advancement in getting to the positions that you're in. As a young Tongan woman who grew up in Tonga, what made you want to pursue a career as a mental health nurse practitioner?
Malo au pito seini and tuka whawhetai mo whamalo ki o tua I he whainga Māori a kutuk mai māku. It is a privilege for me to be part of this webinar. And I guess my brother Siale touched on some of the things and also Jamai as well. So I migrated to New Zealand, following my mother's passed away at a young age. And growing up in Tonga, lifestyle in Tonga is very much different. So we talked about a child being raised by a village. Where you come here, it's quite different, where some families are quite individualized as well. And I guess when I moved here, I had my own family living experience of mental health. In terms of us, notice some of my family stuff is mental health illness as well, completed suicide, so you name it. And in terms of, so I was quite interested in mental health well-being. And moving from the Pacific to New Zealand is a change of lifestyle. Did some of the training and did some of my nursing placement in medical, but it didn't really sort of chill in with me. Did some time in the child and family unit over in Auckland Hospital. And I've seen a lot of Pacific families coming through the services. And at that time, there weren't many of us Pacific nurses working in mental health. So I guess that gives me an opportunity to look into mental health. Being in the role, working in mental health for over 10 years, and witness a significant increased number of families coming through mental health services. We're looking after, and I think Jemima touched on some of the things that the way we engage with our families. And nurse practitioner is quite a new thing to most of our families, especially our Pasifika families. So it's an advanced training in terms of a nurse. So I can practice as a nurse and somewhat sort of similar to a doctor. So I can do prescribe. And I think I did some work in schools as well. And I noticed that majority of our families do not engage with secondary services for many reasons. Some of them were around the fear of being charged when they come into secondary mental health services. We've known about the increased number of young people completed suicide, and what we found is that not many of them engage with services. So I did see the need for myself to somewhat do something, bring it different to our Pasifika family, and see them earlier rather than later. There's not many Pacific doctors, and so I saw that was an opportunity for me to look into. So hence why I ended up becoming a nurse practitioner. Yeah, so that's me.
Malo pito Makoni. You work directly with Pasifika mothers, fathers, and families. As a nurse practitioner, what role does culture play in your work with our Pasifika families?
Yeah. Culture plays a huge part in my engagement with family. When we talked about culture, culture is the ability for a clinician or health professional to understand the values of the mothers. It's not just about the mothers as well, but also the families. that they're working with, the extended family, understanding the values and what's really important to them. Because if we do get an understanding of what does culture, and because it will help us to understand what underpins the perspective of that person or the patient in terms of what does mental health means to them, or what does postnatal depression means to them. So it's really important for us to have an understanding of what does culture mean, and what are the cultural values of the patient, because it will help us in terms of shaping some of our treatment plan or shaping the engagement with these families as well, because each ethnic group have a different understanding or different values of how and what does culture mean to them as well. So yes, culture plays a very big part, and for us to be able to provide the treatment, it has to be culturally appropriate, and it has to be culturally competent as well. And when we talked about cultural competencies as well, I guess it's not just about being competent, and I think you touched on it, Siale. It's about being culturally empathy as well. We talked about social factors and things like that. So those are the things that we have to somewhat take into consideration when we engage with our family. Yes.
Thank you, Margoni. And I think also highlighting the fact that as Pasifika, before we go into different institutions and get, you know, different training, we bring that our experience and our cultural knowledge and our awareness of what it's like to live in certain areas and to grow up in certain areas. So we're not we aren't blank canvases. We bring that with us, and that contributes to the way we deliver the services, you know, and interact with our families. Margoni, in your line of work, are there culturally appropriate frameworks when working with our Pasifika families?
Yes, and I think most of us are aware of, there are many cultural appropriate frameworks that are out there for health professionals to use. I think most of us are aware of the whanawhare model as well, and I think that's one of the frameworks that's possibly mostly used. There is the matalafi as well. There's the sei tapu as well, which is the cultural and clinical frameworks for workers, and also it does support services as well to look in terms of how service delivery. But I guess one of the things that I want to highlight, Siale, is that one of the things that us health professionals have to keep in mind that these frameworks are generic frameworks. And I guess this is something that it's always sit with my heart, and sometimes it's quite frustrated for me to see that non-Pacific tend to think that we are all the same as Pacific. But within Pacific, in our Pacific families, there's mixed ethnicity as well. There's the different ethnic group. And that's something that we have to take into consideration, that one size doesn't fit all. Yeah, so when you talked about framework, it's there to guide us, our practice, but it's one thing that we have to keep in mind is that the whanawhare might not fit every family. The Samoan family might prefer a different framework. So it's something that we have to be mindful of when it comes to working with Pacific families. They're there to guide us, and in terms of how we ask questions and how we engage with our families. And I think that's the very important thing, is how do you phrase and ask those questions? Those are the things that we need to keep in mind as well. And Jamai might touch on it as well. Tell me about your experience. You know, when you talked about talanoa, some families, they do come to, I guess, to non-Pacific services thinking that they'll see Pacific clinicians and they get a non-Pacific clinicians, and some of the questions that have been asked, it's not appropriate. So I guess it's something that we have to keep in mind when we ask questions, is that make sure that the question is non-judgmental. Use the frameworks, but try and work in a better way that it makes, because myself as a health professional doesn't mean that I know everything about, although I'm Tongan, but I don't know everything about the Samoan. I don't know everything about the Samoan values. So those are things that we need to be more aware of. So it's not just about frameworks as well. So we have to adapt our practice into these frameworks as well.
Thank you so much, Magoni. And I think what you've also highlighted is that while there are inter-ethnic variations, differences between ethnic groups, we also have to be mindful that there are intra-ethnic variations, differences within our own ethnic groups. And Siale and Jamai both touched on it, you know, in terms of the intergenerational differences. So you can't make assumptions, and I think that's an important point. When you're working with different people, you cannot make assumptions. I've got some questions that are general questions that's open for anyone in the panel to answer, and I guess it's just around your ideas of what an ideal Pacific maternal and paternal mental health service look like. So, in an ideal world, if we had all the funding and resources in the world, what would an ideal Pasifika maternal and paternal mental health service look like? So I'll leave that up to the panelists to answer.
Can you repeat the question again? Sorry.
No, that's fine. So the question is, if we had all the funding in the world, what would an ideal Pacific maternal and paternal mental health service look like?
It would be Pacific-led, driven, governed. The workforce would be Pacific in its truest form. I think that would be the most meaningful impact you could have if you had all the money in the world.
Awesome. And I know that Siale and Jamai, you also talked about the importance of kind of refocusing, so it's not just on mental illness, but you know, drawing on mental well-being as well. I think that's something that's often overlooked because, you know, the focus is more on the, usually the focus is on intervention and postvention, but just investment in the prevention space to build the mental health literacy, as you had noted earlier on, Maima. Another follow-up question to that is, where to from here? So you have all talked about the importance of cultural competency. You've touched on things that often aren't emphasized enough, like grief and trauma. In terms of Pacific mental health, where to from here?
Can I come in there if that's okay? Zeni, Jemima's point is a really valid one about, you know, cultural governance, about, you know, Pacific representation in the workforce and highly qualified Pacific people. But one of the challenges that we have in service provision is that there's a lot of growing research that demonstrate that young Pacific people are not accessing the traditional Pacific services that have been created in the 90s and 2000s. And some of the research say that young people are less interested in a cultural service. They're more interested in receiving an effective service. And an effective service, if it's delivered by a Pacific service, that's fantastic, you know, and young Pacific people will engage with that. But if young Pacific people engage with a Pacific service and feel like their needs aren't being met, they're much more autonomous, much more independent in their thinking. They will go looking for a clinician or a service that meets their needs at that time. And so one of the challenges for us is that we might be creating services that are meeting the traditional values and the traditional needs of a generation that aren't our youth. And so when you talk about what would the ideal service look like, the ideal service has to really look at being a contemporary service, and a contemporary service meaning that you know, the emphasis on language and culture might be very different to young people. And so I think if we don't include young people in service design and service provision now, then, you know, people like me, I'm getting very old, Sani. I might be, you know, put out to pasture soon and go into a retirement village. And so, you know, the next generation of young clinicians, if we're not cognizant, you know, if we're not aware of just the shifting value base of young Pacific people, then we're not going to create services that meet their needs.
Okay, so just following on from what you've said, Siale, so where to from here? what do we need to do as a collective to ensure that that happens, that that services are, they're effective services, they're services whereby our Pacific communities across the generations, would want to engage.
I'm interested in the other panelists' views, so I'd just like to listen for a bit.
Yep, this is open to.
Yeah, I guess when how Siale talked about us involving our youth, and I guess one of the things that we have to be mindful of as Pacific people is that we have lots of our young people that comes in with mixed ethnicity. And that's something that we have to take into consideration as well. And when we talk about Pacific youth that are born in New Zealand, the way of living back in the island, I guess I can speak on this because as a migrant, young person coming from the island and living in New Zealand, the expectation is very much different. And I guess it's good that we have to get our youth involved as well, but I guess it should be a balance of across the generation as well. And I think we have to get our community involved as well, because we have, in a way, we have to encourage our community to take leadership or take ownership of their own health. We here as health professional usually sits behind and sits around and talked about these things. But at the end of the day, and I guess I see this in my role, excuse me, in my role as well as a nurse practitioner. I give my families advice, or I give the mothers and babies advice in terms of how to better their health. And they go home and they do something different. And it's not so much that they don't understand, it's because they have their own way of doing things. They have their own struggle at home. So it's nice to be sitting in a clinic, but I think we have to come out of that. So the way we deliver services needs to change as well. We need to bring services to our family rather than taking services away from them. So we have to get our community involved in a way that they need to take ownership of their own health, rather than us having to follow Western framework of doing things. And I guess there's a gap, and I guess there's opportunity for research in terms of finding ways that works for all of our generation.
Yeah, I think it's about being inclusive, and for our young people, it's about including their parents into some of the treatment and the care that they're given through our mental health services, because ultimately our young people and our service users in general go home to their families. So how do we bring the family on into the fold, and how do we support them in that process to be able to support their loved one who is in mental health services? Because ultimately our service is only there for a short time, and then we move out or we step out again. So there's that episodic care that we step in and help for a short time, and then we'll step out again. But yeah, we need to really bring in the family into that fold.
Thank you to all the panelists for for the reminder that if a service is to be effective, the design is pivotal, and make the views of people who will be engaging in the service is fundamental. We've got a few questions from viewers. One of the questions is there a cultural stigma attached to mental health in Pacific? Do you believe 100%. There is? Okay. Can we talk about absolutely. That?
Can we talk about stigma? Yes, so the Mental Health Commission in the 1990s recognised one of the major obstacles to seeking treatment is stigma. They invested a lot of money in the destigmatisation campaign that's occurred in New Zealand for the last 30 years, and I think they've done a good job. And people like John Kerwin and a lot of people now are really able to talk about mental health, and I think that's one of the really big steps in terms of being able to seek help. And if you think about women who have psychological distress following a delivery of a child, only about 25% of women, 1 in 4, with significant mental health issues in the postnatal period seek help, and Pacific people are the lowest of that number. So, it's a huge issue, and stigma is probably one of the main reasons, but there are other factors involved, but that's a really important issue for us.
Yeah, Yeah, I guess stigma is still very much present in terms of mental health. And when we talked about mothers accessing mental health services, as Dr. Siale Foleyaki mentioned, it's not the best as we hope. And I guess it's something that we need to look at in terms of where do, I guess, the understanding of what does antenatal depression looks like, or what is postnatal depression looks like. So increasing awareness, because there's no, I guess for myself as a Tongan, there's no such definition of postnatal depression or antenatal depression. There's no explanation in terms of what does that look like, or what does the symptoms look like. But the more you talk to these mothers when they come and seek services, they've experienced it, but not knowing what they've experienced. And I guess it's also because within our Pasifika families as well, I guess the word mental health is still very not much unacceptable as well, but also it's the way we deliver services as well. Not all of us can deliver services that fits in with the needs of our family. So we do have families that access services and they decline services or not engaging with services because we are not providing services that they're expecting. So that stigmatized things as well. And how we act as well and how we talked about mental health is not very acceptable, I guess. Yeah.
I think just touching on what Makoni was saying, sometimes with the signs and symptoms, our loved ones, we kind of normalize their behaviors when they've changed or something's kind of different. So it's really good to just even with our mothers, it's always good to ask the simple question like, are you okay? They'll either say yes or no, or they might come back to you later on and say, you know, I'm not okay right now. So it's looking at, okay, so, oh, mum, you know, so-and-so's not doing so well. You can see that, but then something, she tries to mask it or tries to cover it. So, and you know that wouldn't be the normal sort of behavior for her. So the ideal thing for any mums that are going through, you know, stress levels is to ask them that simple question. And, you know, they may not say yes that day, but they may say yes another day. So it's always good to check in.
I'll just also make a plug for the use of technology. There's growing evidence that, and you know, again, talking about our youth, our Pacific youth, they're very comfortable with in the text space, and you know, receiving, being able to message and send to our helplines out there in the community. Our Pacific young people are big users of helplines, and I don't know if there's any research showing that's the case for our pregnant young mums. But there's research that shows that the level of, you know, going back to the stigma issue, you know, the level of disclosure in terms of intimate information, there's really good research that shows that there's high levels of disclosure via text and sometimes anonymous helplines. And so I just wonder, you know, as a Pacific community, you know, we can invest in, say, some trusted brand, you know, whether that's Lavar or another Pacific organization, a trusted brand where Pacific young people, and, you know, I think 40 and under, I think over 40 is a slightly different age group, but, you know, the use of technology, and we're also finding outbound calls, so we can do counseling now, like this webinar's a technological advancement. I think we've got over, you know, sort of almost 90 attendees listening to this conversation. And so, you know, the use of technology to have potential outbound counseling within our Pacific community using Pacific languages with that Pacific cultural expertise. Yeah, I think the technology conversation is an important one for us to have as well.
Thank you, Siale. I think you've pretty much answered the where to from here, you know, in terms of what's possible moving forward. Maima, is there anything that you would like to add in regards to the stigma?
I think, like, I think that the ladies touched upon it, normalizing the conversation, but not only normalizing it, transforming it and making it a lot more Pacific focused. And by Pacific also, you know, being mindful of where our Pacific communities are situated. They're not completely urban. Also, whether they are engaged in the educational system, whether they are employed, unemployed, it's just being very mindful of the diversity that is within. And so we can't assume that stigma, all the conversations around mental health and well-being are one size fits all, even within Pacific. So yeah, it is like anything to do with the sector. I think Pacific people have the answers, because like we've said during the inquiry, that what works for Māori should work for New Zealanders, and the same could be said for Pacific. And I think we get it right in that we've never seen mental health as something that was negative. It was what was kind of like imposed and framed in terms of the Western way. We saw mental health as being everything that there is around well-being. It was not until kind of the Western framework made it kind of negative, and it was all a push towards illness rather than wellness. So until we start, what I'm trying to say, until we start having those really positive conversations, and I answered one of the questions, until we start addressing equity, then we're not really ever going to see a real shift. We could sit here and tell them all night about it. 20 years ago, Siale, you would know, we're still having the same conversation. The point is, who are we going to start? I think now we need to start lobbying. We need to start being a lot more, not just vocal, but, you know, infiltrating in different spaces, whether that's, you know, making decisions, whether that's knocking on the doors of our politician, whether that's putting applications in for funding. You know, it's ensuring that we cover every base to address that equity.
That's a big conversation, Jemima.
Yeah, it is.
Yeah.
And it's definitely a conversation that needs further exploring and actioning. You know, as you've noted, Maima, it's something that Siale has been talking about for the past 30 years, but something that we really need to continue to do and really mobilize, especially the younger ones coming through. You know, there's strength in numbers, you know, so that the louder we can raise these, especially at that political level, I think the further we'd go as a people in Aotearoa, New Zealand. I'm mindful that we only have 4 minutes left, and I said that we were going to start at 7 and finish at 8. So I'm going to ask the panel just for a take-home message. For those who have sent through questions, don't worry, your questions will be answered and they will be uploaded on our Moana Research website, and as well as a recording of this webinar. So I'll hand it over to our panelists, just a take-home message before I ask our mātua to close us off in prayer. We'll start with Siale.
Okay, my message would be, if you really want to invest in the mental well-being of any society, any community, invest in mothers and babies.
Thank you, Siale. Maima?
Yeah, our children and our young people, absolutely.
Awesome. Iris?
I'd say the same. Invest in our antenatal and 0 to 4.
Oh.
Yep. And sorry, Magoni?
Will be the same as well. Our younger generation is the future of our future generation. And I guess for those who are listening, if you're non-Pacific, please don't be afraid to ask the questions. Just be mindful on how you ask the questions at the same time. As Pacific people, we do know when you're not very generous. So don't be afraid to ask questions. But yes, we need more clinicians, Pacific clinicians in maternal mental health, or even to increase our antenatal care as well. So we need to engage more of our Pacific families. And I think Jamai also mentioned midwives as well, because in terms of antenatal care, our midwives are the ones that are in the front line in terms of providing those services as well.
Thank you. Maloa pito to all of our wonderful panelists. For those of you who are listening and viewing. I told you that we have absolute stars on this panel, so thank you for your time. I'll now hand it over to Alfata to please close us off in prayer.
Okay, before I close, first of all, thank you, Saini, and also members of our panel for your contribution to our program tonight. And most importantly, to members of the community who were able to watch and listen to the program. I'll close with Karakia. Heavenly Father, we are coming to the end of our program. We believe the presence of your Holy Spirit within us empower us so that we can able to answer questions for the betterment of our services to our people in the community. We ask for your blessing upon all those who were able to watch and listen to the program, and also all our staff members and members of our panel. May you wish to grant them knowledge and skill so that they can provide the good work for our people. And may the grace of our Lord Jesus Christ, the love of God, and the fellowship with the Holy Spirit be with us all. Amen.
Amen. Thank you so much, Alfata, for that beautiful prayer. Before we head off, on behalf of Moana Research, thank you once again to our panelists and to everyone who's tuning in. We look forward to your attendance in our next webinar. This will be one of many. So keep an eye out and we'll keep you posted. Malo Alpito, and God bless you all. Malo.
Malo.